Hi, I'm Dr. Randy Doom, and today we're going to discuss a problem that commonly afflicts a lot of people, and that is carpal tunnel syndrome. I'm sure you've all heard of it. Now, a little history there. There's actually 4 stages of carpal tunnel. The ones that we're going to be talking about primarily are stages 1 and stage 2. Stage 3 and 4 is generally reserved for geriatric people with spurring in their neck, and we're not going to be addressing that issue. The one I'm concerned about is the grade 1 and grade 2 carpal tunnel syndrome. Now, the standard treatment protocol for that is primarily injections or flattening out the hand with the brace. Now, I'm to tell you that is the exact wrong thing to do, because when you do that, as you'll see what happens with my hand, I'm actually stretching the muscles across the tunnel of Guyane, and that's the tunnel that the median nerve runs in. And what happens is inflammation accrues around the median nerve, and you get this pins and needles feeling in your hands. So medical doctors typically want to put you in a brace, then inject your wrist with cortisone, and then they want to do surgery. Now, here's the situation. First off, if you stretch your hand like that, you're increasing the inflammation around the median nerve because, as you can see, the muscles are tightening up. It'd be much better to relax your hand, wrap some tape around it, and sleep like this so the median nerve has time to breathe. Secondarily, the problem where the symptomology is, which is in your hand, doesn't originate there. You have to remember, that's the end of the median nerve. The median nerve traverses all the way through here, around your elbow, up under your shoulder, under your clavicle, right into your costo-clavicular joint, and it also branches run in off of your neck. So, if you want to successfully, and I have successfully treated carpal tunnel for a number of years, basically you have to address the system that's involved, and then the symptomology, where the end result is, will go away. Now, if you have surgery on that, generally here's what happens. As long as you don't go back to doing what you were doing that created the problem in the first place, such as a carpenter, a plumber, or a mechanic, you're going to be fine. The minute you go back to doing what you were doing before, you're going to get the problem right back again in 30 days. Only your pocketbook is going to be less about $15,000. So that doesn't make a whole lot of sense to me. Better to biomechanically correct a problem by addressing the involved issues or the involved areas, and then you'll get rid of the problem and it'll stay gone. So that would be my recommendations for stage 1 and stage 2 people that are suffering from carpal tunnel syndrome. And remember, if you want to look, feel, and act years younger, join the bandwagon. Be a Randy's Raider.